Thank you everyone for joining us for this important event on small business in Canada. Thank you to the organizers, Minister Mary Ang, Minister Vic Fideli, Chamber partners, and all the sponsors for making this event possible. And welcome today to our panel on mental health matters, the bottom line on employee mental health. My name is Anissa Tour, and I'm delighted to moderate this panel today. I'm the Director of Group Benefits at the Leslie Group, and I've been working in the group benefits space for the last over 17 years. The Leslie Group is one of Canada's fastest growing independent employee benefits consulting firms with clients and employees across Canada. And we work in both the group benefits and the group retirement space. We work with our clients to navigate the increasingly complex world of benefits as employers face the challenge of providing valuable benefits to 5 generations of employees in the workplace. With a focus on mental health, wellness, and a proactive preventative approach to health and care becoming more important than ever, we leverage data and technology to provide tailored solutions for each of our clients. Now, before we introduce the panel, I want to set the stage for our discussion. Prior to the pandemic, we weren't really in a great space to begin with. It was projected that 1 in 2 employees in Canada would experience a mental health crisis prior to turning age 40. Mental illness was the leading cause of disability in Canada and still is today, and mental illness costs over $51 billion annually, absenteeism, disability costs, and other healthcare costs. And then the pandemic hit, and Canadian businesses have been hard hit by the pandemic, and no more so than small businesses. They've been particularly hard hit. They've had to weather cascades of shutdowns and restrictions on their ability to earn revenue. They quickly had to learn how to digitize their workplaces and their services. And their employees had to adapt to a new landscape for the workplace too. They've been juggling homeschooling, caring for the elderly, getting sick, dealing with anxiety, Zoom burnout, and more. The stress is showing, and experts agree that even as we emerge from the pandemic, a mental health crisis is on the horizon. And then to add insult to injury, at the same time, Hays Canada found that over 49% of Canadian employees were seriously thinking about leaving their current role. 53% of them were looking for better benefits, 44% were looking for career development, and 40% were looking for better work-life balance. So the mental health of Canadians is leading to a potential crisis, disproportionately impacting small and mid-sized employers, with employers facing higher employee turnover and resulting in higher recruiting, retention, and retraining costs, absenteeism related to disability, and higher benefits costs. Now that's the scale of the problem that we want to address today. And to help me do that, I'd like to introduce our expert panel and ask them to say a few words about their organizations and how they come at this issue. So first, I'm going to invite Yolanda Blinkoff from Alevita to say a few words about your organization.
Thank you. So Alevita is a virtual solution for alcohol and substance use disorder. We take a very proactive, modern approach. And so ideally, an employee will learn about Alevita very early in their curiosity or questions around their use of substances, alcohol, or what have you, really trying to change this dynamic so that we don't have to wait until a crisis happens, but instead we get to the employee early, give them the tools, education, and support they need, both medically, therapeutically, and through technology, and hopefully avoid a crisis altogether.
Wonderful. And then Darcy Michaud from HR Primed.
Thank you so much, and hello everyone. HR Prime is basically a full service HR and health and safety consulting firm. So we provide online products as well as boots on the ground, if you will, and our biggest product, I suppose, is our on-call service. As it pertains to this conversation today, we've had a real uptick, even before COVID, as you said, Anissa, with questions about what are our employment obligations, what are our legal obligations around employees who bring forth issues of mental wellness, what are our obligations to inquire, and of course, what are our obligations around accommodation, which is a tricky subject whenever you're dealing with anything that's human rights. So that's the type of support and advice we provide to our clients across Canada.
Thank you. And then we have Stefan Belair from Dialogue.
Hello, and thank you, everyone. So I'm leading the mental health programs at Dialogue. So Dialogue was founded with the conviction that we could improve employees' well-being by using technology to deliver excellent care. This is our mission. We started with a simple virtual care app that was connecting a user to a nurse or physician. Today, Dialogue is a fully integrated health platform that includes primary care, mental health, and employee assistance program. We serve millions of Canadians throughout our virtual platform, roughly 8% of Canadian population, through partnership with more than 50,000 organizations in Canada, from small to large businesses. Thank you, everyone.
Thanks, Stefan. And then we have James Gardner, a wellness coach from First Star Therapy and co-founder of Workplace Wellness.
Yeah, thank you very much for having me on here, and what a panel to be a part of. Honored and humbled and truly grateful to be able to share sort of our experiences and what we're doing with Workplace Wellness. So my name is James Gardner. I'm a certified athletic therapist, a certified strength and conditioning specialist, and a Hatha yoga instructor. I've partnered with Matthew Arnone, who started a company called Mindframe Fit. He's a professional soccer player. Majority of our time has been spent in the athletic space, but the more and more that we have begun to work into the mental health realm with athletes, this is a uniform product. This is a uniform platform where mental health and physical health are not two separate pieces. They're deeply embedded, both in the athletic space as well as in the corporate space. And so we've developed this platform, Workplace Wellness, that is truly collaborative and holistic in its approach, in navigating the introspective nature of each individual in a group space. And what we found is it's really generating a lot of positivity outward, inward first, and then outward into cohesive environments, and starting to really embrace compassion and understanding and empathy in workplaces and in locker rooms. So that's where we're at. I really, again, thank you so much for having me here, and I look forward to being a part of this panel today.
Thank you so much, James. I'd like to think that we have a really well-rounded panel, and I'm really excited for our discussion. So I'm going to start off with Darcy to give us kind of an HR perspective on what we're looking at. So employers know that they have obligations to their employees who are experiencing health issues or addiction. Can you help us understand those obligations?
Sure, it's relatively straightforward. The one thing that it's helpful for employers to keep in mind is that mental wellness and disability in general, cognitive injuries as such, that's addressed as a protected status under the Human Rights Code. So as such, employers do have an obligation to accommodate. And along with that accommodation comes the job protection that is afforded to the employees. So they have certain rights and protections which are afforded to them up into the bars of undue hardship, or in certain cases, frustration of contract. Both of those ends are incredibly difficult to meet, and kind of a last obligation for the employer. So as far as the actual accommodation itself goes, especially with mental health issues, a lot of times you're not going to see like physical accommodations that most employers would be more used to. It's going to be like reworking a job schedule, different types of duties. A lot of times it's, again, technology being a outlet or a support for them if they're working from home, especially. So all these are viable accommodations that an employer can provide. The only really other important notes that I think employers need to be aware of is that it's important to get satisfactory medical from the jump. None of us, well, not all present company excluded, at least I'm not a medical professional and most employers are not. So it's important to get that client down the road of getting the help they need. And you also have to be mindful of the health and safety of both the employee and the employer, or the employee and other employees, which could mean something along the lines of outplacement services. But again, that's a last chance resort, but that's determined by the medical professionals in play.
Okay, great. And how's technology changed what reasonable accommodation might look like?
It's changed quite a bit. So like for me, one of the things that I've kind of doted on my employers about is it's great that you're sending your employees home and working from home. And that might seem like it's less of a responsibility or obligation on you being the employer, but in truth, the obligations of the employer remain the same. So working from home creates a different type of gap or a different type of barrier to providing the supports that you're obligated to provide as an employer, but more importantly, that the employee needs. So that's where technology comes into play. Technology is way more efficient. There's more options. It's less expensive than it used to be. So the idea that you could not provide these types of supports either as a reactive measure to someone who's suffering with a mental illness, or even better yet, as a proactive measure, so you don't get there. The idea of saying we can't do that or claiming undue hardship because of the cost or option no longer exists. So it's really opened up the spectrum and offerings that employees or employers can provide to their employees, and employees ultimately with a good cultured employer are looking for in where they work.
Yeah, we see that in healthcare too, right? So we've seen, it's incredible working in virtual care, how much people thought, well, that's not possible. Like, no one's going to want to do that. Oh, we don't know how to use technology. But yet, I'm not exactly up to date on the current stats, but a large majority of Canadians have visited some sort of health professional in a virtual way, right? Mm-hmm. So all of the things we were worried about, they worked out. Like, people did it, and actually people liked it, which is even more interesting.
Absolutely.
Yeah, there are some pieces, sorry, just to jump in, there are some pieces there with the manual practitioner side of myself and my role with athletes and human beings in general. There's that access piece is absolutely incredible, what this has opened up. There is a silver lining there, certainly. What we've found with the clientele that we typically work with and that are now entering the realm into sort of, the corporate workspace is, there's still an element of necessity to human interaction beyond the screen as well. So as things begin to open back up, how do we navigate that? What ratios are we playing sort of, through this online accessibility, and then that in-person, that energetic component of things, physical touch, things that humans need, that's going to play a big part in this as well as we sort of bounce back or embrace what this is now, right? And so the access and just talking about all those pieces, I think absolutely phenomenal, but also with, with a grain of salt, how many experts are out there. We also have to be able to navigate that through HR and through employers, that we're getting the right help from the right people, because there are a dime a dozen experts online. So again, just navigating that with a bit of caution in terms of who you're dealing with and knowing who you're dealing with, credentials and otherwise. And so just to take that one step further, I'm not a mental health practitioner, and I think that's full transparency. I'm not a mental health practitioner, but each one of us experiences mental health, and to speak to it and to have the opportunity to be heard and listen goes a long way. And then having referral networks to people in mental illness and these other pieces, this is going to be touched on, I'm sure, throughout the day, but really great opportunity through online. But again, remembering that in-person piece is still going to be an element into the future, at least in sort of our manual practitioner and working with other human beings. That's still a piece that I don't think we can go fully virtual and call it the same as being in person.
Oh, thank you for that, James. And you touched on something else too about, the importance of knowing whether or not you're dealing with a good practitioner. So whatever that space is that you're looking at. And I think, the employer can really contribute to that by making sure that, you've got some vetted programs in place. You've got, the virtual healthcare, you've got some addiction services, you've got things that are vetted that the employer says, hey, these are good options, versus leaving somebody to just, go into Google space and try to find something. So, these types of programs, I think, are really strong and important. And even us at the Leslie Group, that's something that we really work with our clients to make sure that they have in place, they have access to, and things like that. So really great point there too, James. And another question, Darcy, is there an obligation that an employer has to providing access to treatment?
Yeah, that's kind of a loaded question. Yes, you do have an obligation to provide access to treatment. Typically it starts with the employee. So, the employee, as long as they feel comfortable, and that's a big part of it, right? The employee is going to come forth and they're going to make their concern known. Sorry, just got a phone call going on. But as well, there is a duty for the employer to inquire. So if you see the signs of mental wellness, whether it be an individual or it be in the group of your employee base, if you will, you do have a reasonable obligation to step in. And that might mean, providing technological or in-person supports in advance of, you getting to a bad place for an employee or for all of your employees. But then, of course, if you do have an employee that comes forth when you're talking about access, your obligation then steps up. You have to make sure that if that employee needs time to go see a medical professional, or needs time to go for a walk, or has a plan that they're working with a medical professional that they need to see through, it's your obligation to provide that to them in the way of access and accommodation.
Right. Got it. And how big is the issue of access from your perspective? What are your clients dealing with? What are the challenges you're seeing?
It's difficult with COVID. So because it's not like it's a game changer, not so much, and it's ironic that we're talking about it from a mental health perspective, but it's a game changer in so much as that people who physically need they need supports, and there's people there's people out there that they can go see or go talk to. A lot of them are scared. We've come so far about awareness and access when it comes to mental health in society, and you're starting to see, and it's in part, and it's a good thing, it's part of the rise in mental health cases reported to employers. But on the other hand, now that COVID's come around, there's a lot of people that are scared to access medical professionals just because of the fear of COVID. And that's why I think technology plays a big role in, these platforms that you were talking about earlier, Nisa, and, they play a big role in not only providing employees access, but it provides safety. It's a safe place when you're going to a third party through your workplace. You don't necessarily have to go see a medical professional in person, but you may. It provides options, and anytime you can provide an employee with more options when they're struggling, the better job you're doing as an employer.
But options are confusing too, right? Like you can see how it creates an activity. Like I think, you'd mentioned Leslie Group trying to sort of narrow it down a bit, right? Because it's actually kind of overwhelming. There's so many people you can see and do. And then I think we have done such a great job in mental health, but we're really talking about like that garden variety mental health, right? Like people will post on LinkedIn that they have a little bit of anxiety or, something happened that was a depressive episode. But it can be very deep, right? The issues around mental health can be very deep. And so I don't know if employees really feel that they have permission with substance use disorder or manic or, something more significant than what sort of they read in the newsletter the few times. And then where do they go and how are they ensured that that is confidential? It's a lot. It is a lot to ask in a short period of time.
Definitely. Go ahead.
Go ahead. Sorry, I think just one little offshoot of that as well, when we're talking duties and obligations of an HR department, and that's not me, but I truly see a parallel here as working in the sports space for the majority of my career, strictly in the sports space. As an athletic therapist, a lot of stuff comes at you from athletes, from coaches, from administration, wherever it's coming from. And then it's our duty to sort of navigate and turn said athlete to the right professional, right? And get them guided in the right direction and take on the parts that we can within our scope of practice. But here, when we're speaking about looking out for others, I think that's the bottom line here, is when we have a duty or an obligation to others, that truly begins with helping those individuals understand themselves first. And so if we can find sort of an avenue for awareness within, we start to spin sort of the model of healthcare on its head and say, like, okay, self-advocacy is where it truly begins. So if we can coach that first step in sort of understanding internal environment, we can then begin to have an awareness and a relationship with the external environment. So seeking help, having those that Darcy touched on, those that are coming forward and saying, like, I need help here. That's not an easy step to take, but it's an easier step to take when I understand that I'm struggling. And I think so it's showcasing the opportunity for everyone to see that they're really writing their own story as we go through life. We're writing our own story. We're experiencing the external environment and our internal environment our own way, right? But everybody is doing that in their own way and in their own understanding. And so beginning that relationship, that piece that Darcy has touched on and Yolanda's touched on and Stefan has touched on and we've all touched on so far, is that awareness piece. And that's where it begins. And I think having advocates in the HR department, doing all of this stuff is absolutely critical and advantageous for everybody who's an employee, right? Having somebody who's going to bat for you. So just a little offshoot and maybe not directly on topic, but access and really helping the employee understand actually who they are and that what they're going through is their experience, but there are plenty of supports in place and it's just getting them aligned with those right supports.
Yeah. And one of the things that I think is really a silver lining of the pandemic is that I think people are a lot more open to talking about mental health now than ever before, at least what I've seen with my clients, with, plan members that we talk to, employees, friends and family. Like, I think we all understand that many people are dealing with challenges from a mental health perspective. And it's kind of been normalized to be like, this is okay, because this is what many of us are experiencing during this pandemic at different levels. And so that self-awareness is there because number one, like it's being told to us that, hey, this is going on and you might be feeling this, and you kind of self-identify that this is going on. You feel more comfortable to talk about it because there is that that stigma has come down a lot. And then what I would like to think is that if you've got the right tools in place as an organization to support your people, now we're going to get the help that we need. We're going to get people on the track. So, the pandemic has been terrible for so many things, but I'd like to think that it's going to get people the help that they need, maybe quicker than they otherwise would.
Yeah.
So that'll bring me to some questions, regarding, addiction in particular. So I know that during the pandemic, there's a lot of different stats. Maybe Yolanda, you can share some numbers with us if you have them around about the impact of the pandemic on addiction or substance use.
Mm-hmm.
So in particular, when we think about the addiction crisis, can you give us a sense of how that addiction crisis is intersecting with mental health?
Yeah, that's a great word to use. It seems very, big, bold to say a word like crisis. But frankly, if you really think about, when we were kids and people were smoking, this was like a terrible thing. All of these people smoking. Why would anybody do that? It's so bad for you. Well, just to sort of back up, there are more individuals in Canada that drink heavily, excessively, than there are smokers in our entire country. Right. So as a population of those that are employed, the large majority of us take some sort of substance. So really what that means is that we are ingesting something that is a poison on purpose, right? Just like people would smoke a cigarette, in a workplace, which is so like not something someone would do now. So why is that? Why are we continuing to see that increase in alcohol consumption over time, right? So we've seen people who, it used to be that, minority of individuals would drink. Now we're seeing much more. In Canada, we have significant substance use disorder for a whole bunch of reasons, one of which is that our serving sizes can be confusing, right? So what is a unit of alcohol versus what is this huge jug? Walk into your LCBO, there's orange flavor, there's these kind of things, big containers, right? It's really difficult to sort out what you're actually consuming. And then we also have this pandemic, right? So where people have used coping things to cope, something like a substance, especially alcohol, which is legal, or cannabis, which is legal, it feels like an easy way to sort of move in that direction. So as a general population, we have increased our drinking reportedly 19% as a population of individuals. Women has disproportionately increased. So 41% of women have admitted that they drink more now than they did before COVID. And 30% of employees have admitted to drinking during the work day, because there really is no difference between sort of your bar and wine fridge doesn't exist in the office, right? So it's a little closer to us all the time. And so what does this mean? Does it mean that, we're all suffering from substance use disorder? Well, in some degrees we are, right? Like we were choosing to use a substance. But what this means sort of for the employer, especially the small business, is that this is the first step on a road that could really be a tsunami for us. And so we've got to get into this conversation early and raise awareness, because as employers, this is just not a topic that we've talked about in anything but the very furthest end of the continuum. We talk about it when it's like, this person needs to go to rehab. This is a crisis. They need to be removed and punished from, being here, and there's shame involved. But we haven't sort of started the conversation kind of 10 years earlier, right? We've got all this time that we could use.
Absolutely. So yeah, you've also touched on, is there, in particular for small businesses, what would you say the scope of the problem is for them? Is it disproportionately impacting them? Like, what would you say there?
I think it is. So, I mean, if you think about, who suffers from a quote unquote substance use disorder, that would be something that would be, a treatable, more significant concern. So it's 2 in 10 employees, right? So if you are a small business, you are not immune to that 2 in 10. But what it does mean is that your culture and the roles in which which each individual employee plays in your organization are significant, right? So let's say you're a small business owner and you have substance use disorder, which then gets to a crisis scenario. Your employees may think different of you, right? Like, where am I working? And, is my job secure? Is this person capable, right? So things that we would never consider with other chronic illnesses, right? You had a heart attack, right? Like, these things happen. We do go to a place where we're unsure about people's capabilities, and it does rock culture. And then, if you are in a point of a crisis, it can be having an individual be completely disrupted from their work. Errors can happen, things can become unsafe. And so we want to avoid that in any workplace, but we really want to avoid that in small workplaces where every single person is such a critical component of the workplace.
Absolutely. When we think about addiction, we often think of hard drugs, but Alevita largely focuses on alcohol. What is the role that alcohol plays in the mental health crisis, and how has the use of alcohol changed during the pandemic? I know you touched on that a bit, talking about, like, obviously the rates are going up. Anything else that you want to touch on there?
Well, I think that when we think about addiction, right, that word addiction, we sort of think of like that toothless, homeless, like hit rock bottom person. But truth be told, like, addiction is Barb in accounting, right? Like, addiction is someone who plays hard, works hard, comes to work. They are really suffering, but they're usually making it work. And quite honestly, the large majority of individuals in the workplace who have an addiction they have a hard line, right? Like, they're waiting until they leave the office. Alcohol seems to be more of a gateway because it is accessible and legal, but that can lower inhibitions and increase things like opioids, cocaine. Cannabis is legal now, but it also seems to be, more often a secondary drug. So Alevita can treat anything. What we do by having all employees learn about Alevita is that it lowers the stigma. So, we generally invite you as an employee to be curious about alcohol and partying, and your Friday nights become, tricky for your Saturday mornings. And that's maybe when you finally feel you can say, okay, well, I actually take cocaine, right? Or there's something more, and we're going to work with you with no judgment. Because at the end of the day, the point is that we want a productive employee who is able to move past this without this being a crisis.
Got it. And how effective is technology in providing assistance with addiction in the format that Alevita is using it?
So technology is so huge. We've talked about this in anything related to healthcare. What I would say is that there are certain things where technology will have a role, and then as things start to open up, people will decide to do a bit of a hybrid. But if you think about something like substance use disorder, imagine yourself saying, okay, what does this mean for me, right? Do I have to go to rehab? Do I have to find somebody to watch my kids? Do I have to, leave my house, my job? All of those things are huge barriers, right? And so we're able to treat individuals where they are. So we can't change, your job. We can't change your family. We can't change all of those things. But what we can do is allow you to continue to work, be private, and have your employee be no the wiser. But it also means that we have this wonderful way of being able to be collaborative, right? So, if you are someone who arrives to Alevita with a substance use disorder, and you've also had an injury or you have a co-occurring health issue, we have this ability to, encapsulate your family physician, your virtual care with something like Dialogue, work with your coach. We also at times have employers, right? So where you maybe escalated that situation, where the employer is aware, we can sign consents, we can work as a team, and really optimize outcomes with all of these players being at people's fingertips, which is really, really great for the user.
Amazing. And what do the types of clients that you guys work with look like? Is this more like a tailored approach for larger employers with big budgets, or with technology, I would imagine that the costs have come down and it may be more accessible to smaller employers?
Yeah, that's exactly the case. So we have quite a few small employers who choose to offer this in their plans because it really is not cost prohibitive, right? And so, one claim, one person who quits their job, one person who goes on disability pays for the program, excessively. We do seem to skew with unionized groups and large employers only because, one large employer equals so many small employers. But when we look at them on a group per group basis, there isn't a significantly higher amount of big businesses over small.
And what would you say that employers need to know about the addiction crisis, and what role do employers play for the solution?
So I think employers need to be able to start a conversation. So I think, we know that we're supposed to walk 10,000 steps a day. Shoot, we even wear watches that show us that. We have an alert that says, oh, sitting is the new cigarettes. I got to get up. Like, I've been sitting for too long. I should speak to a friend. I got to walk my dog. All of these healthy eating habits. Really, how do we learn all those things? Like, frankly, we learn them from our employers, right? And so if you think about modern preventative diseases, the most untreated preventative disease that we have in the world is substance use disorder, because we are uneducated. And that's probably because when we think about kind of that conversation the employer's having, the one ring that's missing is to talk about alcohol and substances at all. Like, it's just not even in the conversation at all. And so you've got this ability to say, it's great that you work out and that you're trying to move your body. It's great that you get up from your chair. It's great that you're acknowledging the importance of mental health and eating well. But let's also talk about, how much substances you're consuming, and let's do it in a really confidential, private way. So we don't want it to be that an employee has to go to their employer and say, okay, now I think I surrender, help me, right? We're all adults here. We want you to be able to come to Alevita the same way you go to a physiotherapist or you would log on to Dialogue. Your employer should not have to know.
Completely agree. So that brings us to, just talking about virtual care in general and talking to Stefan. Stefan, I can imagine, and I know that you guys have been incredibly busy, just like Yolanda's team, since the beginning of the pandemic. You guys were already growing beforehand, but then the pandemic hit and things went crazy. So what is Dialogue seeing during the pandemic, and how does that compare to the pre-pandemic world?
COVID-19 has accelerated the healthcare digitalization by a decade. We've seen incredible growth and demand for virtual care services, even public services joining forces. Over the past year, especially around mental health, on our platform, we've seen and we've observed around 20 to 30% increase in utilization on the platform, which is, clearly highlight, I think, the mental health crisis that we're in. Maybe it's different factors. Maybe it's people are more self-aware. They're looking for solutions. They're feeling, the symptoms of mental health, and employers are doing a very good job in, awareness and education. But it all leads to higher utilization on the platform. On the other side, when we're looking at COVID-19 pandemic, it also accelerated the adoption by the healthcare industry. What we're seeing is that virtual care services are becoming an expectation. Our clients are coming to us, and latest surveys showing that 82% of Canadians stating that employers should provide virtual healthcare, as one of their standard benefits, part of the portfolio. So it really changed our industry, and we're seeing that growth, and we're not expecting this to change post-pandemic.
Definitely. What challenges do you see in implementing virtual solutions for employees? Are there any challenges?
When we're talking about the challenges for employees, and when we're looking, it's more towards maybe implementation of those services. So when we're implementing, virtual solutions and everything, it was really one of the things we looked at when we designed our integrated health platform. We wanted to remove normal challenges associated with new technology and virtual solution. So our goal, it was to offer a single platform, and the platform play in healthcare, it's something that will grow in the future. It solves a lot of the pain point that we're seeing when we're looking from an employee standpoint. We mentioned, the sea of new offering out there, especially in mental health. We can say it's probably like the Far West at the moment. A lot of people are riding the wave and releasing new apps that we can find. However, we don't know really what's the value and, the outcomes and the research behind those new technology or new services. So with that integrated health platform, we wanted to unify a lot of the service that we're finding out there around well-being and remove those fragmented access. So when you're an employee and you look at the vast majority of offering that you're having, maybe your employer will give you access to a lot of those services. But at the end of the day, these are multiple access points, different user experience, multiple logins, multiple passwords, fragmented experience. So if I'm starting a consultation on a virtual care platform, and on the side I'm doing ICBT treatment on an app, nothing is very connected in the world today. So that's why the platform play is very interesting. On the other side, a lot of the challenges around implementation for small and medium enterprise, it's HR and the load on the administrators. We're going to be talking about managing multiple providers, multiple relationship, multiple onboarding and engagement programs to run, employee eligibility. Are you going to be managing those? And at the end, we want to make sure that every technology or every services we're bringing to employees, there's an impact, a real impact for their well-being. How do you monitor that impact? If you have like a lot of different reports, you're going to have like to do correlation and try to find, insights. So having like that platform, ease of implementation, it will give you like all the insight isn't in a centralized place. And this is basically the main challenges we're seeing with that new technology. Sometimes it can bring confusion and complexity.
Yeah, definitely. It's one of the things that when we're working on communication material for plan members for our clients, we do have to spend time explaining you've got this piece over here and you've got that piece over there. So, those providers that can kind of integrate at least a few of those pieces are very, very valuable, and clients really like that. In terms of the types of groups that you work with or companies that you work with, Stefan, are the services that you offered more seen with larger employers, smaller employers, and how has that changed throughout the pandemic?
I think virtual healthcare is more accessible than ever to all businesses. I think those SaaS services are easy to implement, and basically it doesn't matter if you're a small or medium enterprise, you can get access. And it's about, at one point, democratization of access to care. And that's one of the pillars when we're looking at programs and how we are able to bridge the gap between access and care. So it doesn't matter if you're small businesses, a large business, anywhere in Canada, coast to coast, we can provide, a unified access to care. And we're talking about, how technology can help. We're talking about, getting access to, depending on your case, direct access, maybe mental health specialists in less than 60 minutes, psychologists in less than 24 hours.
Amazing.
And this is coast to coast, no matter small cities, big towns, we're able to, I think, have an even ground and unified access. And that's the main thing to small and large corporations.
Yeah, it's tremendous what we've seen in this space in the last few years. These types of solutions were typically, when I think about the solutions that Alevita offers in the space of addiction, what Dialogue is doing, these types of services historically had only really been affordable to very large companies. And those that were very, located in more urban areas. And now, the solutions that are available, it's across Canada, it's small companies, large companies, they can all afford it now with the with the use of technology, it's just brought the cost down so much. It's tremendous. So it's very exciting times, at least in terms of what we can do to provide care. And then the other piece about access, one of the things that we really struggle with in Canada and all of the provinces is access to mental health practitioners, specifically psychologists. There's huge wait times for them. So again, these types of platforms just give better access to these types of things, which is incredible and great to see and helps with the care of the members.
And you're right.
Go ahead.
Just to finish on that, we've been reading latest studies that shows that in Canada, access to mental health, we're talking anywhere between 25 days to over a year, depending where you are in Canada.
Yeah.
And that time is critical when you have mental health challenges. You know, it's the impact of that wait time. It's creating and it's adding to the crisis that at one point we're seeing only the tip of the iceberg, because we're not able to basically match the demand that we're seeing from a mental health perspective.
Yeah, and for a small business, that person's either not producing or they're on disability, right? So that's months and months of time where you're not replacing that hire. You're not sure, you're in limbo. It's devastating for everyone involved.
Yeah, and this problem was there pre-pandemic. It's just getting worse now, given that we have so much more of a demand. So again, hopefully technology and the tools available can help to alleviate some of that burden. So Stefan, we've got 2 government ministers in attendance today. Are there any policy solutions that would improve your ability to help small businesses and their employees to achieve better outcomes for their health, specifically mental health?
Yeah. So I was reading an article this morning talking about new guidelines in the public sector around telehealth. And I think we need to make sure to continue on the improvement we've done during pandemic. So we've lowered a lot of barriers around telehealth, and it's been proven to be a very effective tool to help employees. And for me, there's still a lot of stigma around mental health, and awareness and education is key. Government should be continuing to encourage organizations to invest in their health and well-being of their employees and look for new technology and solve their challenges. Government should help, maybe regulate that space and providing a good framework to make sure that employers can choose, a platform that it's proven, that it's secure, that deliver real outcome, and it's trusted and backed by research. So government helping, like building that trust with those new technology, I think it's an important role to provide better healthcare to employees, but also remove some of the pressure that we're seeing in the public healthcare system, because every people that are reaching out, let's say to Dialogue, they are not, reaching out to the public healthcare center and system. Sorry, and we're seeing on Dialogue only it's around 2,000 consultation per day that it's not going in the public sector. So basically, we are increasing access to quality of care for millions of Canadians, and this is a very effective solution to the crisis that we're seeing.
Wonderful. Thank you, Stefan. So James, we're now going to get into a few questions with you, and again, invite the rest of the panel to join in if needed. From your perspective, dealing with high-performing athletes and now wellness training with CEOs, what can you tell us about the link between mental health and performance?
Yeah, absolute direct relation. You know what I mean? So regardless of situation, regardless of context, we were having this conversation with a couple athletes this morning, and whether we're in the business space or in the athletic space, performance is typically based off of validation numbers, performance on ice, on the field, in the office. These are externally validated components of life where we are sort of coached along through life to validate our existence based on external factors. And so I think as we begin to navigate this space, mental health, which we all experience mental health, and where it begins to slide to mental illness, that's where professionals who are in this space need to be on board 100%. But as far as that goes, I think navigating the internal environment is where it begins. And employers who show compassion, we see this as an act of compassion when an employer goes to bat for employees and shows the things that each one of you has talked about today. We're going to provide these services for you, or at least access, or at least provide, the channels to get to the right services. So when it comes to performance on the field or performance in the office, we don't distinguish between the two when it comes to sort of our platform and who we're working with, because ultimately it comes down to the human experience. Mine is mine, yours is yours, but we're doing it together in an environment, in a workplace, whether that's small business or large business. I still need to be relatable to myself first. I still need to be accountable to myself first. And if I'm not, then I'm constantly seeking this external validation. And it's been brought up in a few different channels today. And one, I'm wearing a ring, that's counting my heartbeat and doing these different things. So now I'm reliant on something external to me to tell me how I'm feeling. I didn't reach 10,000 steps today. I disappointed myself, right? As opposed to like, how am I actually feeling? Like me, can I go inside myself and say, I had a good day today. I'm going to take this off. I'm going to put it on the table. And I'm going to say, maybe I didn't walk 10,000 steps, but I had a great conversation here. I was relatable here. And even on the flip side, I had a terrible day today, but I managed. I coped well here. I didn't cope well here. And it's this internal check-in, I think, that has really been highlighted through COVID and through a pandemic. All of these things existed to some degree prior to COVID. COVID has highlighted a number of things, and silver linings or not, it's highlighted the introspective nature of humanity, the human condition to value ourselves based on external validation. And that's not to say that's negative or wrong. That's just to say that's the reality of employment. That's the reality of athletics. Like if you don't win, you don't have to go too far in Toronto to see what happens if you lose in the first round of the playoffs and you start to hear all of these things. That's not dissimilar to employer and employee relationships in certain cases, right? And so I don't know if I answered it, but I do think there's a piece here that really starts with compassion. And to be an employer, to show the compassion for your employees, to be relatable with your employees, that's going to bat. That's being in their corner. That's putting things in place that are going to help, or at least can help if and when needed. And the proactive piece is massive versus reactive. But at the same time, if you have both ends covered, you're in a much better situation. And that compassion goes a long way for me, the employee, saying, wow, they're doing all of this for me and with me and helping me cope. I'm going to put in a lot more effort on my side just based on that relationship alone, right? In terms of having an employer that goes to bat for me, I'm going to go to bat for them. And we see it in the team setting, right? Like, let's talk sports. We see that very much. I'm going to play harder for her because she's doing the same for me, versus they don't give a, you know what? And so why? Like, why am I going to keep showing up if they're not going to show up, right? And so take that to the workplace, and our platform really showcases the individuality in a team setting, but beginning to express that amongst one another. So we create a safe space that's been touched on here to share if and when you're willing. And it can go from 3 employees to, however many employees. And to begin to see who I am and what I stand for, that's the beginning of understanding others. And that's where it becomes this compassionate piece and this empathetic piece within that space. And so I know I took this way maybe off course, but I think all of that to say the foundation starts here with the internal locus of control, and the external no longer dictates, how I'm going to be evaluated. To a certain degree, it has to, but I mean, it's not as heavy that way, right? So take the ring off and check in with yourself. How often, right? We use the 20,000 and the 6,000 on a regular basis. We breathe 20,000 times a day. And how many breaths do we pay attention to? We have 6,000 thoughts a day. How many of those thoughts do we pay attention to? And how many of those thoughts take us way off track? How many of those thoughts keep us on track? And how many take us to a bad place or a negative place, right? You talk about, and just to take that a little further, is like you talk about alcohol, right? And alcohol usage and these kinds of things. And again, I'm not an addiction expert. I'm not a mental health expert, but alcohol is a depressant. It is a suppressor. It hides certain things that are going on. If we liken that to giving somebody a drug when they sustain a concussion, we're now hiding symptoms. So I'm not concussed. Look, I don't have a headache. I'm fine, right? If there's a headache present as a concussive symptom. So if I keep hiding those away and burying these things, eventually it's going to crop up in other areas of life. And so this is where proactivity versus reactivity becomes critical. And that starts with being open to receiving care, being open to delivering the fact that I need help and these kinds of pieces. And I don't think any of those can really begin by having them jammed down your throat. You have to be ready to accept that for yourself. And that's kind of where our platform begins. So like we've kind of taken the East and the West and merged them together into like a physical and mental practice, because we don't see them as siloed. They're directly entangled. We know that movement causes benefits in the brain physiologically and responses in the body. And we know that the breath does the same thing. So we talk about a suppressant versus a down regulator. Like we can use our breath to down regulate. Science proves it. We can use our breath similar to a drink. Right? If we do it the right way, if we're coached the right way, we can do those kinds of things. And I'm not saying that's a direct replacement. And I'm not saying that breathing replaces care for addiction. But as a tool, we've talked about toolboxes. If I give you a hammer, I don't care how you use it the way that suits you for your job, for how you're going to use it. You want to use it to drive the nail in with the handle? Go ahead. You want to use it this way and hammer it in this way? That's awesome. That's the way you're going to do it. So the content that we provide through a platform is relevant to the context that it's utilized in. So the employer, the employee knows what the company needs, and situating the right platform, the right skill set, the right toolbox for those employees makes all the difference in the world. And to bring it full circle, that's an act of compassion. And the more compassion we show within ourselves and within our relationships, that's what's going to drive ultimate positivity and change. And that's not to say like, oh, everything's positive. But the idea here is compassion builds empathy. Empathy builds compassion. It starts within. And when we can showcase that in an environment, the overall focus, the overall productivity is sort of an offshoot of that, I think.
Wow, James, that was a lot. And
That was a lot. I'm sorry.
A lot of good stuff. I think what I'm taking from that is that it's about, successful organizations are the ones that will weather this storm of dealing with mental health challenges and dealing with, we even touched before about the fact that we might be facing a lot of turnover in organizations, people feeling like they want to leave their organizations for different reasons. It's about culture and creating a culture that fosters that feeling of taking care of yourself, taking care of your physical health, your mental health, providing tools, normalizing mental health challenges. I'm not feeling great today. I'm going to take a walk. I'm feeling stressed out. I'm going to stop and I'm going to breathe, maybe having, a breathing session that you do once a month or once a week with your staff. So it's really creating that culture that says I don't want to use the word sympathy, but understanding that we're all going through stuff. Right now, we're actually all going through things, but even outside of the pandemic, we're all going through things. And creating a culture that allows you the space to do that and gives you the tools and says it's okay and says, I don't have to be, working my butt off the whole time and like that's what's rewarded, but saying, hey, you're actually rewarded for saying, I'm going to break right now and I'm going to actually eat a lunch away from my computer, or I'm going to break right now and go for a 5-minute walk, and creating a culture that is supportive of those types of activities to take care of your mental health that will help you long term. I think that's kind of a little bit what you're talking about there.
Empathy and sticking to the boundaries, right? Because when we're doing it as a group in an employment setting or a team setting, if everybody's doing it, then we're all respecting each other's boundaries while we're doing it together. And you're right, support and connectedness. If I feel supported and connected, the want or desire to go somewhere else is going to be a whole lot less. Absolutely.
Well, that was a great way to wrap up our chat today. I've got to be mindful of the time. So that's amazing. And I want to thank you guys all for joining me today for this chat. Just a couple of closing remarks. I really look at it the way that, employers that are really going to take more of a proactive, preventative approach will be in a better position to weather this storm that we're kind of facing, the storm of mental health and potential turnover in your organization. So that means making sure that you have a group benefits program in place that is actually valued by your plan members and provides support for their mental health and their wellness. This will add some cost on the front end, but will help to save a lot more costs downstream as employers are able to manage and reduce their turnover levels, reduce their absenteeism, including disability and more. So I want to thank everyone today for your time, and I invite everyone to join us. If you have any questions, join us at our virtual booth. It's the virtual Leslie Group booth. We'll all be there to answer any of your questions. And thanks so much. Have a great day, everyone.
Thank you.
Thank you for having us.